In this video, we're going to be talking all about the physiology and norms of our bladder. So really how our bladder should work. Sometimes this helps us identify where our bladder is maybe not doing so well and is going to help direct you into some information about how can we optimize this bladder function. As your body becomes more balanced, as we start being able to integrate the pelvic floor, we should also see these things improve. So let's get into it. So our bladder is a muscular storage container. So this little guy's, it's flipped around. It shouldn't be upside down like that. But our bladder is a container that stores urine as it's getting filtered by our kidneys and sent down our ureters. It has a sensitive lining, a kind of a ridged lining, but it's this nice stretchy storage container that allows us to store urine, hold it till it's full, and then empty and eliminate it. We don't have active control over the muscle that surrounds the bladder. It is autonomically controlled, just like we can't control our stomach contractions and we can't control our digestive system turning. This is just stuff that's happening on a reflex loop. This is why at about 2 to 3 plus years old, we develop conscious continence, is because we gain conscious control of our pelvic floor muscles, and our pelvic floor muscles and our bladder learn how to work together via a series of reflex loops and conscious control and autonomic control. And so it's a really cool process as we learn to develop continence, which is when we can pee when and where we want to. So when we talk a little bit more about this storage container, it's important to remember that this muscle needs to be able to stretch to hold, and it needs to be able to contract to empty. So those have been maybe told they have a very small bladder, a thimble bladder, right? You're people who are peeing all the time. But this bladder doesn't actually get smaller, and it's actually very open to change and restoring that flexibility, but it can just get into these habits where it's used to emptying frequently and so it doesn't get used to stretching again. And that's really where bladder retraining is going to come in, and that's in a different section. If you are a camel or you hold your pee and hold your pee, we can actually run into scenarios where this muscle gets a little bit elongated, a little bit stretched, and that makes it difficult sometimes for us to get complete emptying of that bladder as well. And so there are 2 different ways that this muscular storage container can swing. I'd say thimbles is more what we see more, but that doesn't mean that the camels shouldn't be talked about here either. This lining is, all these ridges, they're called rugae, that also allows for stretching. But in these rugae, and there's little sensors, and there's lots of nerve endings in our bladder that help us determine the pH of the contents of our urine. So our urine, it can either be more acidic or less acidic, and we get signals for these reflex loops from all these sensors inside of our bladder. Which is why our bladder is sensitive to the things that we eat and drink sometimes. And so if our pelvic floor and our nervous system is all a little bit upregulated, things like coffee and wine, spicy foods, dairy, sometimes may be irritating to our bladder lining and cause us to feel like we need to pee more frequently. In the bottom of this section, there is a whole PDF on bladder irritants, and so I'll let you go check that out and see, are there specific triggers for your bladder symptoms or your bladder leakage. Our bladder, again, should be able to stretch to hold about 2 to 4 hours worth of urine, which translates into about 2 cups or 8 to 15 seconds of stream. So our stream should be nice and even and straight. It shouldn't be spraying or shooting off to one direction. We shouldn't be cutting glass. We shouldn't be pushing our pee. Shouldn't be stopping and starting. And there should be no delay in that starting. And so you can sometimes evaluate your pee stream and how long that pee is taking, and if there's starts and stops, to determine how effectively we are emptying that bladder. So then the next topic is that our bladder is both controlled autonomically, meaning via reflex loops, our autonomic nervous system is our nervous system that we don't really have control over. It's our fight or flight system, and it's all of these reflex loops that are ingrained in us. And then conscious control is what we have over our pelvic floor muscles, and the interplay of these two, again, allows us to maintain continence. All right, and so our autonomics are these reflex loops, and our conscious control is what we can think and feel and sense in order to make things work. So when our bladder gets full, it begins to contract, and our pelvic, if it's not time to go, we can consciously contract our pelvic floor, which holds urine inside. And then as our bladder gets more and more full, the contractions of the bladder become unignorable. And then we make our way to the bathroom, consciously relax our pelvic floor, and via the conscious relaxation of our pelvic floor, our bladder can empty. So I have a little visual here. So at this first signal of needing to pee, about 2/3 of the way full, we're going to get contractions of this bladder lining. Our internal urethral sphincter, we have a little cutoff tube here, and our pelvic floor are both going to contract and hold that pee inside. Once our bladder gets a little bit more full, this internal sphincter goes, all right, we're cutting off, we're full. It's time to go, which then gives us a more urgent signal, like we need to start to make our way to the bathroom, make a plan, but our pelvic floor muscles are going to contract externally a little bit more, which is going to tell our bladder to kind of calm down for a little bit until we make it to the bathroom. We make it to the bathroom, we relax, we sit, close the door, pelvic floor muscles can relax. Then that bladder muscle can really clamp down and contract and let all of that pee out. There are obviously problems that can happen in this cycle, and we're going to talk about that more and how to optimize that function, but it's good to understand how it works when it's working right.